I've been doing dentures for many decades. The color of my hair probably gives that away. As far as my background is concerned, I'm a general dentist, private practice for several decades. I've been teaching implants, dentures, overdentures for over 20 years. And that's because I've gotten into implants when not a lot of dentists were placing implants, especially general dentists. So naturally, I had to be really good in dentures because back then we didn't have a lot of single tooth replacements with dentures, but there were mainly denture patients seeking help with implants. So I had to be very good in dentures very quickly. So that's how my interest grew in dentures. The traditional workflow, everyone knows already. We take the preliminary impression, make a custom tray, take the final impression, border mold. That's a second visit. The third visit, you do a jaw record, vertical dimension, fourth visit, wax trying. Fifth visit is the delivery, and that's not including the post-op adjustment potentially, right? Usually there are many. Compared to that, the digital workflow is slightly different, but there are several different ways, different pathways where a dentist can get in this workflow. The first one I can think of is someone who's very comfortable taking analog impressions. Whatever impression material technique that you may use, you have the final impression, let's say. And you can pour that up and scan that with a intraoral digital scanner that you have in the office. Now that becomes digitized and you're in the digital workflow. Or you can scan the impression itself. Second example would be someone who's had the scanner for many, many years. They're very proficient at it. They can directly scan the ridge intraorally. And that gets digitized, of course, and that's another workflow. The third workflow, the common one that I can think of would be the patient that comes in with upper lower, let's say, existing denture that's worn out a little bit, old. So dentists can take a wash impression and bite registration with that, both dentures. And you can scan the denture with the intraoral scanner, 360, the intaglio surface as well as the teeth surface, and the bite, and that becomes digitized. So there are several different ways you can get in the digital denture workflow at this time. Someone that comes in, a patient that comes in with existing dentures, you can take a wash impression, take a digital bite scan, and digitize the whole data, and actually skip the process where normally we would get a custom tray, a final impression, and then the longest visit probably is when we have to do the vertical dimension, aesthetic parameters, and centric record. That whole visit could be skipped using that workflow. And you can go directly to the wax try-in or the 3D printed try-in. So it'll save at least a visit or two. So that's a huge, I think, for general dentists. Second example that I can think of is, let's say someone that you made a denture using the digital workflow a year ago. And Mrs. Jones calls you and says, hey, I can't find my denture, or my dog ate my denture, or something, or it's broken in half. Then you'll say, normally, that patient will come back in and go through the 4 or 5 visits of creating the brand new denture starting from fresh, from the beginning, right? But if you have the digital file, all you need to do is to call the lab and say, hey, remember Mrs. Jones? Print me another denture, send it to me, and within a couple of days you'll get it, and you'll just have to deliver that to the patient. So this is really huge. You save all that time creating that second denture or the new denture for that patient. So I think for the very first time in my career, I can say that dentures can really help you grow your practice. Whether you're a solo private practitioner or in a group practice setting, this could save a lot of number of visits, reduce the chair time, and actually make it productive for you to do in your office. I personally would want to work with a lab that has a lot of experience doing dentures, expertise with dentures. That means technicians who have a lot of experience, what I'm looking for, so they can do the complex case that I'm about to carry out. The second thing is good communication channel. Every denture case has something unique about that case where a dentist needs to communicate with a lab. And I want to make sure that I can easily talk to someone, and those details that I ask, I want to be assured that those things are reflected in the lab work. So having that good communication channel would be very important for me. Third would be, I want to make sure the lab has all the current technology. Example would be a digital denture workflow, having the proper software equipment, all the 3D printing equipment, and the expertise that go with that would be important. Most importantly, perhaps, lab that's on time. There's nothing worse than having to reschedule a patient because your case is not there. So being on time is huge, I think. And also, it would be nice to have a lab that's more flexible. Some emergency cases where you need stuff a little bit faster than normal, if they're willing to work with you on that, that would be great. Let's say one scenario, you put the Try denture in, and you can immediately tell the retention and stability of the denture before you do your final delivery on the next visit. So you already know if it's going to work or not. So that's a huge point. Second would be, you can check the smile, you can check the occlusion. You don't have to worry about teeth coming off the wax at that visit. And for patients, it's really real. You know, they can see what the final result will be like exactly, right? So I think that's a really game changer. Now, so that's great. And that, you know, if there's some modifications that you want to make, you can grind the denture down, you can add to the denture, you can draw on it, send it back to the lab, or take photographs or scan it, send to the lab. And the final visit comes, you know exactly what to expect, you know the fit is there and all that. Again, I'm a little disclaimer, I'm not a mental health professional, right? But in my experience as a dentist who's done a lot of dentures, here's what I found. Ill-fitting dentures, and then those old dentures with poor aesthetics, this could really cause a patient to become self-conscious about their smile. And as a result, they may avoid social situations, going out with friends, eating out, just avoiding a lot of social engagement. That could be an issue, especially in older adults, as far as I know. When you, as dentists, we have the power and the positive influence to be able to create a well-fitting denture that looks really nice, the smile. This could really uplift the spirit, and patients can become engaged, more engaged again in social situations, and that could really change the outlook on their lives.